Before you start taking Xtandi, it's important to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Swallow the capsules or tablets whole, and do not chew, dissolve, or open them. The dosage will depend on your medical condition, response to treatment, and other medications you may be taking. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same time each day. It's also crucial not to increase your dose or take this drug more often than prescribed, as it won't improve your condition any faster and may increase your risk of side effects. If you are pregnant or may become pregnant, it's important to avoid handling this medication or breathing the dust from the capsules or tablets, as it may harm an unborn baby. Some common side effects of Xtandi include hot flashes, headache, dizziness, or decreased sexual interest/ability. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Be sure to tell your doctor right away if you experience any serious side effects, such as back pain, numbness/tingling/weakness/pain of the arms or legs, falls, broken bones, or pink/red urine. This medication may also raise your blood pressure, so it's essential to monitor it regularly and inform your doctor if the results are high. Seek medical help immediately if you have any very serious side effects, including a headache that doesn't go away, decreased alertness, seizure, sudden vision changes, mental/mood changes, such as memory problems, confusion, or signs of a heart attack, such as chest/jaw/left arm pain, shortness of breath, unusual sweating. Additionally, this medication may lower your ability to fight infections, making you more susceptible to serious infections. Notify your doctor right away if you experience any signs of infection, such as a sore throat that doesn't go away, fever, chills, or cough. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Xtandi, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. Also, it's important to discuss your medical history, especially if you have high blood pressure, seizures, heart disease, diabetes, or if you are at risk for seizures due to previous brain injuries or tumors. Due to the potential risk of seizures, it's important to ask your doctor if there are any activities you should avoid while taking Xtandi. Additionally, this medication may cause dizziness, so it's important to avoid alcohol or marijuana, and to be cautious when driving or using machinery. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. Xtandi can also be harmful to unborn babies, so pregnant women should not handle the medication or breathe in the dust from the capsules or tablets. It's also important to note that Xtandi should not be used by women, especially during pregnancy or while breastfeeding. If you are a man with a pregnant partner, it's important to use a condom during sexual activity and for 3 months after stopping the treatment. If your partner becomes pregnant, inform your doctor immediately. It's important to be aware of potential drug interactions with Xtandi, as they may change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some medications can affect the removal of Xtandi from your body, which may affect how Xtandi works. Examples include seizure medications, such as phenobarbital, phenytoin, St. John's wort, among others. On the other hand, Xtandi can speed up the removal of other medications from your body, which may affect how they work. Examples of affected drugs include asunaprevir, cobicistat, ergot alkaloids, such as dihydroergotamine, ergotamine, fentanyl, lurasidone, pimozide, quinidine, sirolimus, suvorexant, tacrolimus, voriconazole, among others. Be sure to discuss any concerns with your doctor. If someone takes too much Xtandi and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an Xtandi overdose may include seizures. It's important not to share Xtandi with others. While taking this medication, you may need to undergo lab and/or medical tests, such as blood pressure monitoring. Make sure to attend all scheduled medical and lab appointments, and consult with your doctor for more information. If you forget to take a dose of Xtandi, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Xtandi in a tightly closed container at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for the best way to do this. As always, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.